We are very fortunate to have a guest with us today. Our esteemed guest is Mr. Sandeep Saidi, who will be giving us this seminar. Let me give a brief introduction to Mr. Saidi. And this is Mr. Saidi is a licensed physiotherapist with a master's degree in physiotherapy from the University of Brighton, England. He has worked in Tan Tock Seng Hospital for 10 years and was a part-time lecturer in physiotherapy at Nanyang Polytechnic and University Kebangsaan, Malaysia. At present, Mr. Sandeep's in the business of rehabilitation and is interested in creating innovative products for the elderly. Among that, he has a business which is based in Singapore, Malaysia, and Thailand, and has also served as the chair of the education committee for the Singapore Physiotherapy Association, and also the chair of the cardiopulmonary special interest group for the Singapore Physiotherapy Association. And he has been actively sought for in academia for sessions of training and also sessions. So it is an honor to have Mr. Saidi with us today. And Mr. Saidi, we would like to welcome you to start this session. And on behalf of NUSS again, we welcome all members to the session. And we would like to ask you to hold your questions till after the session that Mr. Sandeep has given is over. And we'd like to ask you to kindly please type in your questions in the question and answer button that you see in the bottom of the frame for the Zoom webinar. And I will be the moderator for the panel, which will also take the questions and announce them to Mr. Sandeep. Thank you very much. Please enjoy the session. Mr. Sandeep, please.
Thank you. I hope everybody has got to know me a little bit. Let me start the session. I would like to make it as interesting as possible without having much words in it. And I'll share my screen. Okay. Right. So today, what I'm going to discuss with you, a very interesting topic. This is about what's coming up for elderly in rehabilitation. What's the technology which is being used? As you know, or you may know, physiotherapy started long time ago. It was during Second World War when many soldiers were injured, and then they were injured with bullets or had amputation because of putting their foot on mine. And they needed some sort of physical rehabilitation. There was no profession as physiotherapy at that time. And some nurses took over the role of providing physical therapy to soldiers. And slowly the profession turned into a real physiotherapy profession, started with diploma in physiotherapy. In Singapore, it was run in NYP, and then it moved to the degree and master's program. And now in US, people start with the entry-level doctorate program in physiotherapy. So a lot of physiotherapists in Singapore are called doctors because they hold doctorate degree in physiotherapy. So that's the profession all about. And let's start with the presentation. As I said, I have tried to make it very interesting. There are less words on the slides, but there are more videos to show you, and hopefully they'll be, the videos will be able to play. If you are not able to understand anything, or if you would like to keep some questions, do let us know. I'll be more than happy to reply your questions. Okay, so we want to talk about, let's see what is, aging, the issues, what happened with aging. We are very familiar what is aging. As we get older, the human body is like that. We don't have any plateau. When we are born, we continue to grow until the age of 18. That means the body shows growth until the age of 28. And after that, it doesn't stop there. It starts to decline. So you will continue to see decline from 28 till 80. So it's like hill where you go up very quickly until the age of 28, and then you slowly start sliding down until the age of 20, 80, 84, 85. You never stop there and then peak and then plateau for a long period of time. So that's what happens in aging. We start to age unfortunately from the age of 28. You will also realize that a lot of athletes, they peak between 20 to 26, 27. As soon as they reach 28, 30, people start saying, oh, the performance is reducing or getting lesser because they started to age. That's where we really start to age. So there are some issues come with aging. And as we grow older, some rehabilitation needs are there as well. We all know what conventional rehabilitation is. I will go through and show you what it is. And we'll talk about what's happening with the virtual reality in rehabilitation, how technology is coming into rehabilitation. And we'll also talk about some new innovations happening in rehab. I would like to emphasize when we talk about technology, it doesn't mean very high technology items like computers, like digital world. Technology can be used to improve lives. Even very basic technology can improve lives dramatically, and I'll show you how. So you don't have to really get worried that the technology we will not be able to catch up with technology. It's for nerds, it's for people those who are really well versed with computers, play smartphones. Not necessarily. Technology can be anything. You can develop something, I can develop something which can be very simple technology, but it can still improve quality of life. So let's talk about it. So physical rehabilitation or physiotherapy, there is conventional and there are innovation in physical rehabilitation. We will, as we go along, we will talk about it. Let's look at the elderly population. Just some statistics to stimulate the thoughts. What's happening around our world? Why we have to speak a lot more about elderly population? Why now? Global population above 60 years of age. In 1980, there were only 382 million older adults above 60 years of age. That was 8% of total population. In 2017, there were 962 million. The population increased, but number of elderly increased even more in terms of percentage. So the elderly, 16% of all population was above 60 years in 2017. By 2050, in another 30 years time, the population will, the elderly population will double or more than double, but we will see some increase in population as well. So we expect population to be 10 billion, the Earth population, and elderly will be 22% above 60 years. So what's happening is number of older adults, those who are living longer, are increasing, and there's a reason for it. We will talk about it as we go along. This is global. This is where the world is going. Now let's look at Singapore, because to us, very important is Singapore. We live here. We consume healthcare services here. We want to see what's around us and how we are faring when we compare to the world. So look at 1980 for global population, 8%, 16%, and 22% in 2050. Let's look at Singapore. 2019, there were 12.4% population, which was more than 65. We are not even talking about 60 years. In 2030, will be 22.5% population will be more than 65. That means 1 in 5 adults or population, 1 in 5 people will be above 65. Come to 2050, we will have 1 in 3 above 65. That's scary. That means we have much lesser children to take care of older people, and we are not replacing our population. At the same time, we are living longer. So there are two issues here. One is lack of replacement or of population, and second is not having and living longer. Living longer is not actually not a problem. It's just that how do we manage this challenge? So why are we growing old? Why Singaporeans are growing old? There are two reasons. Major reasons are better healthcare. We are living longer. There are less deaths even at birth. And the average age of Singaporean is 84 years. Male and female combined is 84 years. We live third longest years in life. So Singaporeans live much longer than any other. And most of the countries, only we are third longest living creatures on earth. We have better healthcare. We are one of the best healthcare, I will say, and a very good nutrition. We eat very good diet. Our government is putting a lot of effort on diet as well to improve diets, telling us what is healthy, not healthy. Of course, I think I have not put it as one of the factors, but I think we are becoming an exercising nation. A lot more people are exercising. I don't have the data to support how much Singaporeans are exercising, but definitely there are better we are very exercising more. That would also lead to healthy aging and longer life. This is what happens as we grow older. We start to have chronic health conditions. The research shows at the person above age of uh, 70 years would have 92% will have either of these three conditions: heart disease, stroke, or diabetes, one of them. Yeah. And 77% will have two of them. This is what the data is. Two out of the three: heart disease, stroke, and diabetes. So what it means is 77% people may get heart disease and diabetes if they don't get stroke as we grow older. With aging comes cognitive ability, cognitive health issues as well. Ability to think, ability to learn, and ability to remember. Dementia is common. Alzheimer's is one of the other known word in dementia. So the ability of thinking, learning, and remembering gets lesser and lesser. My dad is 87 years old, and now where he keeps his glasses, he doesn't know. Actually, it happens with me as well. I don't know where I'm keeping glasses. But for older adults, when did they eat, how much they ate, did the domestic help came to clean house, he doesn't remember. So the ability to think, learn, and remember gets affected with aging. Mental health, a lot of elderly get depression. There's a documented 7% rate of depression because of loneliness, not having social support, living alone, or lack of friends. That leads to mental health issues. And a bigger one in physical terms is injury because of falls. As we grow older, we tend to lose balance, and then that leads to falls. And falls is not only falls, it leads to fractures because elderly have poor bony structures, lack of calcium, osteoporosis. So a little thud and bone is at the risk of break. Once the bone is broken in older age, it takes longer to heal, and sometimes we have non-healing fractures. We see in hospitals a large number of elderlies, especially women, having compression fracture of the spine because they sit with the thud, and spine compresses and fractures. It just reduces in height and leads to a lot of pain. So physical injuries do happen with older adults. There's a higher risk of fall. Then there is sensory impairment that also adds up to falls. Not having good vision. The research shows most people fall at home between in the wee hours of morning. Wee hours, I mean, from 3 to 6 in the morning is the highest risk of falls in elderly, because at that time they get up to go to toilet, don't turn on the light, and not having switch around them, just toppling over because of some obstacle or or anything, knocking onto something leads to fall and fractures. This is the biggest risk. So those who are older adults, I will recommend keep switch very close to your bed, so that before you get up, you turn on the light before you go to toilet. This is very common to have injury in the morning. Sensory impairment, vision and hearing, as we said. Another one is bladder control, incontinence. This is a taboo. We don't talk much about it. 1 in 2 women at after the age of 50 have some sort of bladder lack of bladder control and have incontinence, but we don't identify them. They don't come up and identify themselves, and there are helps available, but we don't really think it's a big problem, and we continue to live with it. Happens in men as well, but not that common as in women. So um, those who have bladder incontinence, I'll suggest go and see your doctor. There are some physiotherapy modalities available as well to help prevent bladder incontinence, and you can have that help at home. Okay. When we talk about conventional rehabilitation, we have in aging, you need rehabilitation for majorly 3 reasons: stroke, balance, and fall. That's why most elderly require intensive or physiotherapy rehabilitation. If they don't have either of them, there is very little uh, reason for them to go to physiotherapists. Other is pain, which can be because of falls or back pain or neck pain, but that is more of a issue of executives working in offices, having sedentary lifestyle. Elderly suffer these more, and they visit physiotherapists or have physiotherapy intervention um, more frequently because of stroke, balance, and falls. Okay, so there's a difference between lack of balance and falls. Lack of balance doesn't mean fall. Lack of balance means risk of fall, unstable, instability while walking. Falls is already having falls leading to fractures and having issues because of fractures requiring rehabilitation because of broken bone and reduction in muscle strength. So balance is more of in coordination. Falls is more of strength issue. How do we prevent them? Prevention is stay active, see your doctor and therapist regularly, and eat a very healthy diet. We all have been given advice on a healthy diet. I'm not the expert on it, so I would not talk about diet, but anything to do with exercises, type of exercises, how to do it, I'll be more than happy if anyone has any question on it. The type and amount of exercise, I'll be more than happy to speak to you. Then comes cognitive ability to learn, remember. There are very good help available on memory exercise, like we exercise human body, like we exercise muscles, we exercise joints, we can also exercise brain. So there are brain exercises available, there are softwares available, even therapists, if a person goes to a physiotherapist or an occupational therapist, they have certain programs to help recover memories, if not recover memories, to delay the deterioration. They train task sequencing activities from very easy tasks to make it more complicated and more complicated. So it's relearning. Our brain has um, our brain has reserve cells which take up the function if some of the cells are damaged. Think of a patient, those who have stroke. There is something called motor relearning theory. What it means is, um, if due to stroke, some of the nerves are damaged in the brain, there are reserve cells in the brain. They take up the role of damaged cells, and motor means muscle, relearn, because brain starts to send signals to muscles again for them to function. It's called motor relearning theory. That's why in rehabilitation, robotics are coming in. Robots are type of machines which continue to perform one activity for thousands of time, which a physiotherapist can't perform in a day because he will be tired. Think of a patient who has lost strength in the legs because of spinal cord injury, in road traffic accident, or because of stroke, and they have spasticity or tension in the muscle. Robotics have taken over a role of repeating the movement thousands of times in a day, so that the brain gets this signal from the muscle that this muscle need to move, and the reserve cells in the brain take up the function of damaged cells. That is what motor relearning I spoke about. So muscles learn to work again because brain starts sending signals. So that's cognitive rehabilitation helps in that as well. For mental health issues, social interaction, group activities, family support is the best. As you see, we are becoming very active on phones, having WhatsApp group, having WeChat groups, but there is nothing like social interaction, personal interaction. In business, we say there is nothing like a golden handshake. So when you shake hand, that's where you meet personally and develop relationship. So is for elderlies when they are um, they are alone. They tend to get they get mental health issues. So group activities are good. Even exercising in group is fantastic. The research shows people those who exercise in group adhere to exercise for longer period of time. Exercising alone, you tend to miss your exercise activity. You are not consistent. You tend to drop out your activity. Think, I give you my example. We have a group of friends, those who play badminton. Um, um, we have been playing on every Sunday since 1998. I can tell you, it rains, it shines, there may be earthquake, but on Sunday morning at 9 o'clock, all of us are there. It's a group activity when we play badminton. It's much more enjoyable than when I go and jog. I tend to jog 3 days in a month, and then 3 days in a week, and then next week I think too much is too boring, or there is no one to talk to. You tend to drop out from your activity. Badminton, we haven't dropped. So same is the research tells that group activities are better, way better for adherence. to exercises than doing exercises alone. Also, it helps in mental health because it stimulates thoughts, interaction, support for each other. So this is what human being is. Human being is a social animal. So you take the social aspect out of it, you tend to get mental health issues. So as I say, interact, meet more people, though we may use technology, which I'm going to offer or not offer to introduce to you, but still, as much as possible, have group of friends, have society, have social interaction, have family support, meet more, meet each other. Once the COVID-19 is over, please go and meet in larger group. You don't have to be just 5 people in a group then. So yes, let's wait for this pandemic to get over and we start our social activity full throttle. Okay, when we talk about physical therapy or rehabilitation, we talk about exercises the physiotherapist will give you, to which he helps you do it or she helps you to do it. You do it at home, in hospital, or in outpatient environment. So this is how we see physical rehabilitation when it needs support or require additional support than what you actively do by yourself. But that's not all. There are many things you can do. The technology has come in a big way for physical therapy and rehabilitation. Um, why should we use technology? There are very good benefits of it. Uh, Remember, technology will never be able to replace a physiotherapist's um, touch, because they assess, they decide, they plan. But technology can be used as an adjunct to improve you faster, um, take some manual labor out of a therapist's job, and work as an adjunct to what physiotherapist professional knowledge or intervention is. So it's good to use technology wherever required, and it can be for physiotherapy as well, for exercises as well. Technology is safe, is cost effective, it can be performed anywhere, because you don't really need a space to do that. It can create environment for exercise. We will show you. And it's interesting, doing one exercise, raising hand up and down 50 times, 3 times a day may be boring. After a few days, you may want to drop out. But when you use technology, if it becomes like a game, it becomes like an activity where you achieve at the end of the activity, you know your scores, or you know if you are improving, you tend to adhere to activity better, and outcome for the exercise gets better. Okay, we have some videos to show you how the technology works. I will request Jocelyn to help me to share the first video. It says C2 Care, because I couldn't run video on my screen. Let's see if Jocelyn's screen you are able to watch. If you are not able to see it, please type in so that we know. I'd like to show you some of the softwares available. This is software in which you wear a virtual reality goggle. You can see a person is wearing a goggle, and when he moves up, he sees an arrow, and then he moves up. He can also perform activity, and it shows you progress on the top of the screen. You can do proprioception activities where you want to see where you are, your balance, your rotation. You can also do activities of having a target to reach, so that you know when you're doing an activity, you know if you are hitting your target. Though she is moving her torso, but actually she's doing exercise. So is for hand. You follow what is seen on the screen of your goggles. So these are very, very easily available technology. This is for vestibular rehab. Some patients tend to get balance issues. because of their middle ear having imbalance. It's called vestibular issues, and then you can have vestibular rehabilitation. This is using technology. It's a very simple technology, but can make a person do exercise. It can make person get balance. There are exercise for phobia, exercise for height, those who are scared of heights. So a lot of things can be done with such softwares. What a person needs to buy is a virtual reality goggle. Is not expensive. They are usually $700-800, and there are softwares available. There are many different softwares available. Um, I'll show you more on it. Jocelyn, can we go to the second video?
The co-founder and CTO of Rehabilitation. More than 800,000 people in the United States alone suffer from a stroke each year, leading to long-term disability. Within Tarrant County itself, we have witnessed firsthand that the demand.
Okay, this is one of the other videos showing how
at Rehabilitation, we provide a
virtual reality is being used
solution by developing virtual and augmented reality training exercises that immerse the patient in various 3D therapy scenarios to help stimulate the brain and form new neural pathways. Our products are designed with the help of physical therapists and customized for each patient's needs and their targeted therapy plan. Our goals are to bring down the cost of therapy, make it more efficient, enjoyable, and within the reach of everybody who needs it, so millions of patients can have a chance to lead a happy and independent life.
I've been through a lot of physical therapy, and this kind of makes a different way to do it, and it kind of takes the monotony out of it.
A little bit of cardio and some muscle movement. It's a little bit of everything. It's definitely a workout.
I was doing that game, I was actually really focusing on using my left leg, which was my weaker leg. And like I said, it just took my brain out of it. It was just like, you could just do this. It was fine. You're holding, you're standing on it, you're just holding it, you're not falling over, and it's good. So, I mean, I really like, and I feel like I'm making progress.
I feel it in my legs, I can feel it in my hips, which is what we were actually working on. I can feel it in my shoulders, like my back muscles, all that stuff.
Yeah, because once you lean forward, you have to really contract the back.
Yeah, it's like really like a full body workout.
The VR has really helped me so much. I have weakness in both legs, both ankles, so
balance
to isolate the muscles and then become stronger. You're also trying to balance and use the right motion to hit the target. So it's pretty hard, but it's pretty good, yeah.
And I tested out the virtual reality because, not that will help you your balance coordination, but your mind is focused on the game as opposed to you're worrying about your balance.
It's like sometimes when it makes me move to the right or the left, I feel like it helps with my coordination, and so that's where I see the biggest benefit. And then it's fun, so you don't realize you're getting some type of therapy while you're having fun.
Okay, right. Back to my slides again. Now, virtual reality can also be used for cognitive rehabilitation. As we spoke about how conventionally, I would like to show you how conventionally an occupational therapist works to improve memory, improve cognition. And then I will show you how it can be used, how technology can be used to do that. Jocelyn, can we play the video called Conventional? The one on the top, Conventional. So I've picked up these videos to show you how...
So what we're going to work on is memory right now. So what we're going to do is we're going to match just the colors and the correct number with the color. Okay? Color and number. Don't worry about the suit. Okay? All right. You ready?
Now this person has to remember the card.
You got to guess.
Open
And
similar
then just
card on the
remember
other
where
side.
everything is.
If it's
That's
not
your
correct,
luck.
if it's not
All
correct,
right.
put it down.
Keep on going.
So that's to improve memory. At the same time, it's an activity where you're using your hand. So
This
there is
brings
some
up the
activity,
difficulty.
but idea
Okay,
is
everything
to...
is not in line. There's more cards, and you have to try and remember exactly where everything is. Okay, all right. Let me know if you can reach that when you need to get up here over here. Okay. Good.
Oh, lucky.
Yep. You can stack them and put them on the side. Beautiful.
I see.
Jocelyn, you may turn off the video. That was to give an idea how the conventional therapy works. May I request you to play the next one, Jocelyn, which says Rehacom? Now, similar thing can be done on the screen. And such games are available online for free. This is attention training. Remembering the card, exactly the game what the occupational therapist was playing with the patient. So you can do visual training, find where the bird is. So such kind of softwares are available. They are cheap. They are free as well online. You can look for it. Jocelyn, you may want to turn it off. Okay, that's how the technology has been coming in rehabilitation. Now let's look at just general how technology has come in. Jocelyn, could you please play general?
And everybody's running.
Everyone's running?
100 miles an hour.
Stretching over more than 800 meters, it is the largest covered outdoor escalator system in the world.
And you could look around and see above, below you, and you actually felt like you were there.
But you're underwater with a diver.
Times Square? Sure. And remember to go shopping this time.
Now we're looking at virtual reality in a whole series of age-related conditions. So when we think about dementias, and we think about Alzheimer's, and we think about Parkinson's, we think about macular degeneration, we do think that VR can play a role in helping some of the side effects of these unfortunate diseases.
Can you see it?
Yeah. Is it side enough?
Whichever way you look, you're looking.
At my age, it's such a new thing, I just can't comprehend, particularly the young people now who are studying, what they have at their fingertips that we didn't have.
The Roman Forum used to be the center of everyday civic life in Rome.
There were the pictures I saw in my Latin book, and I couldn't believe I really was seeing the pictures I used to see with my dad in a book, and I actually was in the middle of it all.
I think everybody here will enjoy it because it's just different, you know. makes you feel like you're traveling.
This is a generation that grew up with all kinds of things were invented while they were growing up. Television, vacuum cleaners, dishwashers. But if you think about most of these devices, they were installed and plugged and play. It's actually ironic that older adults are the ones who are waiting for technology to catch up with them. Only the younger generation right now is willing to read a 60-page instruction manual to figure out how to use something.
Might be one of those things that I could go down and sit down and plug it in and go to Spain or New Mexico or wherever you wanted to go and see the scenery.
Right, yes. So that's fantastic. See how technology can take you where you have not gone to. And this is also great because in a situation like COVID, where you can't travel, it can be really useful. One more video on pain management, how the same technology is used even for pain management. Can we have this video, please? This is the second last video. Then we have one more, I think, at the end of it.
Experience of the mind sort of being in this environment when it's immersed in this sort of peaceful, positive environment. It's almost like the rest of your experiences are unable to be noticed because it recruits so much of the brain to focus on that spotlight that everything outside of that environment falls to the wayside during that experience of virtual reality.
Cedars-Sinai here in LA is one of a handful of hospitals experimenting with a surprising new treatment for people suffering acute pain.
Wonder if we could start by asking how long you've been here at Cedars-Sinai and what brought you here, please?
I've been here for about 4 days now, from chronic back pain.
Okay.
I'm just taking some medications and possibly an epidural very soon.
I'm in the hospital because I have a total artificial heart, and last week it had a failure. I've been on hard medication for pain for 5 years, and I'm really trying to get off of it.
So I'm constantly having pain up my left upper quadrant and my right lower quadrant. It goes into my back. I can't relax. I have had every test possible. If there was a surgery, I'd do it today.
Chronic pain is more than just a physical experience, but it's the biopsychosocial experience. And virtual reality has a way of affecting people physically, emotionally, and to some degree even socially.
I'm excited to try something different, something new.
Hey. All right. You ready?
Yeah.
Every time they send us a new one, it's a little bit lighter. So you want to go to Iceland? We'll try that?
Let's do that, yeah.
You afraid of heights?
I'm not.
Oh, perfect. Take a second for it to start. Virtual reality undoubtedly has an effect on the human mind. It sort of hijacks the brain. It can be used for evil, but it can also be used for good. What are you seeing?
There's like ice formations. It makes you feel like you can grab them.
You know, honestly, in the 18 years I've been practicing medicine, I can't think of anything that I've done that's more effective, and you can physically see their body language change. They often will look straight ahead like they're looking at a still image. The moment that they turn their head, that's sort of the magical moment.
It literally is like total panoramic.
360.
Yeah.
VR's backers say that at the very least it does no harm, and it's got the potential to cut down on the need for drugs like morphine, make patients more relaxed, and even have them wanting to go home sooner.
Would this be something you might reach to before, let's say, morphine?
I'm sure that I'll probably try this first, followed by the rest of the stuff.
Right.
That was, in a million years, I never would have thought that they would have brought it to a hospital to use. It really felt like I was there.
And this helps me relax. And when the muscles relax, the pain goes away.
VR seems to take patients out of their pain, at least for a while. But it also seems to take them out of the confines of their hospital beds while they have the headsets on. For those trapped by their conditions for long periods, that may be a welcome relief. and help mitigate some of the stress of being in hospital.
You know, it's kind of like a jail cell, really. I can get out, I can go around, and I can walk and everything else, but you still end up in this 4 by 10 room.
We need a virtual reality pharmacy, shelves, so to speak, of VR content that's evidence-based, that I can reach off the shelf and map to my patient's needs. And the more of that we have, the broader the opportunities we have to engage patients with virtual reality. This is not about Silicon Valley entrepreneurism. It's about when and whether we should interact technology with the compelling human experience of being a patient. It's not a computing science, it's not an engineering science, it's a social science.
Thanks, Jocelyn, you may turn it off. So you can see how powerful this particular tool is, and there are so much of research going on this. Is not is really becoming very effective. Pain management, stress management, physical rehabilitation, geriatric rehabilitation, balance training, you name it, and it's becoming. And the number of research papers published on virtual reality as a technology, which is so simple. It came as a gaming technology for people. Even if you go to Bangkok or Pattaya, sometimes you will see people wearing it and they charge you certain small amount of money to play this game. But the number of clinical tools developed with it are fantastic. They are really good. And I think this is the way to go if you can manage pain, with taking a patient out of thoughts of pain, because pain is a lot of psychological as well. I used to work in Tan Tock Seng Hospital 10 years ago, and I remember patients in ICU, because I'm a cardiorespiratory physiotherapist. In ICU, patients tend to get depressed, those who stay there for 10, 12 hours, because only thing they can stare is the roof, because they have nowhere else to see. There are only walls, not even windows in intensive care. They do not know day, they do not know night, because there are no clocks. There is no sunset, there is no sunrise. So what happens is a patient tends to get depressed. I think virtual reality will work so well for them to be out of an environment and then feel what's happening outside, and also good for their well-being. Okay, the future is here. Think if a physiotherapist is sitting in his office, in his hospital, and making you do exercise at home, but he's still there as well. This is coming soon. This is the hospital in nursing home in Australia. They have started something called transporting a hologram from doctor's office to patient's home, so that doctor can talk to patient face to face, even if not being there. Let's have a look at the video.
Chain, our vision is to deliver the world's best health and aged care in people's homes so they can live their whole lives as they choose. We know that Australia's demand for healthcare is increasing, partly because of an ageing population, but also because of the increased number of things we can do in hospitals. And our research shows that about 30% of people in Australian public hospitals today don't need to be there. And we know we can deliver them really high quality care at home. Now, this will not only increase the safety, increase the convenience, and be what people prefer, but it will relieve the pressure on our public hospital system for people who really do need that level of care. Our new technologies allow nurses who are on a day-to-day basis responding to clients in their home to be able to have really good access to the data, be able to have their hands free while they're reading data, but also importantly consult with the doctor and have the doctor see what the nurse is seeing and the data at the same time as giving the nurse advice about how to treat the patients. This significantly increases the capacity of the nurse to practice at the top of her profession, and it gives the doctors an incredibly efficient way of being in many places at once. Enhanced Medical Mixed Reality, or EMO as we call it, creates a hologram of a doctor. So the experience is a doctor's really personally in your home, talking to you, in dialogue with you, looking at you and consulting with you about your healthcare. So the experience is a doctor has come to your home and visited you. We think this is going to meet the demand for increasing healthcare for our community in a way that's not only less expensive, but is much closer to what people want and takes the pressure off our hospitals for the future. It's part of our vision for a new generation of healthcare for Australia, and it's coming soon.
All right. Okay, so that's what is coming soon. Only issue at the moment is voice travels faster. Voice travels later than the hologram. So once the 5G technology is here, it will get better. Now, technology doesn't mean it has to be very computer oriented. Technology can be, it doesn't have to be expensive. It doesn't have to be computer based. Technology can be simple, which can improve life. I'm introducing something which I please very honored to be part of the developing this product. We have done a lot of things on it, and I think and I believe it will improve quality of life for elderly really, really dramatically. Think of people, those who have never climbed stairs, because they do not have anything to climb stairs. Normally, when you climb stairs, you either have a stick which gives you support on one side and is very unstable, and you need to hold the bar on the side. If the stairs have no bars on the side, it's very difficult. Also think of going to toilet and there's a one small step, and sometime for people those who do not have any issues, they will climb up without any problems. But if you have limitations in your physical capacity, 2 steps can be like climbing a mountain. So I'd like to show you what I developed, or part of my team developed. I hope you enjoy it. Idea is, there is no idea of selling. Idea is to show you what technology can do for you. Even simple thought can change the quality of life of thousands of people. Jocelyn, may I request you to play this video? I'm very proud to have this video. Okay, right. Jocelyn, thank you very much. I think that was the last part of the presentation. In conclusion, with technology, we can improve life. It can be an adjunct to a therapist. It will never replace a therapist. It will help them to improve a patient better. It can be cost effective, and it can be interesting and objective. A lot of research studies on it is not something which is off the shelf and never been tested by the doctors. Thank you very much. That's what my presentation is all about. We can move to question answers if there are any.
Okay, thank you, Mr. Saidi. Thank you so much for the fantastic presentation. I was riveted to the screen and very, very, really enlightened by all the new technology that's out there to help seniors. I think there are quite a few questions from the audience. I am going to moderate the Q&A session now. And I have to say that I have quite a few questions of my own as well, because
sure.
I'm going to that section where I will need all this equipment to help myself. But let's attend to the needs of the audience first.
Yeah, sure.
So I will not state the name. I will not state your name, but I will state your question. So please listen to your question. The first question is this: I am 58 and I'm getting to be forgetful. I cannot imagine what will happen to me by 70. Any advice and effective intervention when it comes to dementia? I suppose this is from the viewpoint of physiotherapy.
Right. Yeah, I'm not a dementia expert, but I worked in a dementia unit some time ago, and I will say, as long as and as much as you can stay active, please do so. Do not leave activity. There is nothing like retirement. As long as your brain works, your body will work, and you'll continue to work as a normal human being. So please continue activity. Social interactions are really, really important. If it really goes to a level where you need help, please go and see the doctor, the geriatrician. They will advise you what to do.
Thank you, Mr. Sadi, for that answer. The second question that comes in is, do the VR therapies require consultation with therapists?
Yes, it does. Because they will decide what sort of software you will require, how much activity you need to do, and also before and after they apply virtual reality, they will measure you because they want to see objectively have you improved. So they will do a test before and after. In between, you go through the therapy and they'll tell you how much you have improved. Some of the softwares, they also have testing capacity. They test you before and they test you after and give you a score. Have you improved in your balance, your activity, your strength? So some of them do that.
I see. Could you elaborate a bit more? I'm going to help the person who asked this question. When you say the software, do you have to buy and install it into a machine, or is it online software?
There are some online softwares. There are also free softwares available. I do not want to recommend any because my idea was to introduce what is available and what's coming. You can also talk to your therapist. There are professional software available. You don't need anything. You just need a computer. You can load that software on computer. Even softwares are available on your mobile phone nowadays. Because you connect your mobile phone to this headset, you go into a virtual world.
Okay, the third question is related to this whole setup issue. So this is about the hardware. The question is, hi, I may have missed the info, but where can you buy this equipment? And I think he's talking about the equipment that we saw the people wearing on their head and also the handsets. Could you talk about
Simlim Square, these are standard equipment. Go to Simlim Square, you will find them. It's very easy to, there is no, it's, as I said, it started with gaming, but the software developed, the key is software, key is not hardware. Hardware is computer and virtual reality goggles, which you can buy anywhere. Download the software and they give you the activities you require for stress management, training, balance, whatever. Yeah.
So they can go to any computer store and buy this hardware?
Yes, they are available. Even online, you can find on Lazada.
Okay. And what is the name of the hardware if they go online and find it?
Yeah, there are some companies called Oculus Rift, OCCULUS, Oculus Rift, HTC. I can remember two names now, two brands. There are 3-4 brands. You can find them.
Sorry, I mean, what is the search? If they're going to put in a keyword to search for the software on Lazada, what keyword should they use?
They will not find the software. They will find the hardware.
Yes.
Hardware will be, they have to put virtual reality goggles.
Okay.
Oculus Rift is one brand I remember. I think Microsoft makes another one. HTC, there's another one. There are many more.
I'm familiar with the Microsoft one. It's called HoloLens. So
yes, that's correct. HoloLens, yes.
Now, the other question is actually very interesting. Is VR technology used in hospitals in Singapore?
I think there are some of them. I have spoken to some physiotherapists. They have mentioned that they have seen it, or I'm not too sure where they are using it as a therapy, but you may want to call a hospital and find out where they have it as a therapy. I know my wife is a physiotherapist as well. She's in one of the nursing homes, and they have just tested the technology on their elderly, and they really like it. Even the elderly like that because they go into a different world and they perform many more activities. It's coming very, very soon. If it's not there, you will see in 6 months.
That's very exciting. That means when you go down to your neighborhood or your hospital physiotherapist that you're seeing, you should definitely be engaging them and asking about these therapies, and you know that you've learned through NUSS on this session that's provided by Mr. Saidi. The next question is very, very relevant question. Although we focus on the elderly in this session, this question that comes is there any equivalent use for rehab in small kids?
Yeah, I mean, because this session was for elderly, so I have picked up all the relevant information on elderlies. There is a lot more data on virtual reality with children with attention deficit disorders. They're called ADHDs, spastic children, cerebral palsy children, attention disorders. There are a lot of data and a lot of clinical applications available for them. Yeah.
That's very encouraging. So I do encourage, other persons who are joining the session, if you feel that there's a need even for young patients, please do explore further on how this can be relevant as well. And maybe we should have another session at NUSS.
Yeah, sure. They'll be more than happy. Yeah.
Okay. Now, there's this question that comes in and asks, an aged patient above 90, for example, tends to lack concentration. Will VR rehabilitation help?
Yes, as long as they are cognitively aware of what they are seeing. If vision is okay, because these goggles can be worn even on your spectacles. If you have eye vision correcting spectacles like you and me are wearing, they can be worn on the top of it. As long as they can see, they can hear, they can, yes, it's useful. It's useful in any condition. Only drawback happens is some patients, because I have used it in my clinical practice as well, some patient tends to feel giddy after that because it takes you to an environment which is very unstable, though it's safe. So some patients feel giddy, but that only happens, only happens in probably 5 to 10% of patients, but they also get used to it once they have used it for certain number of times. It's like going on treadmill for the first time and you feel very groggy when you come off the treadmill. But if you're doing it regularly, then you get used to it. So yes, any age, it's useful.
Okay, great. And another question, when someone has a stroke, does physiotherapy help? If so, how soon and how frequent should the patient start doing it?
Physiotherapy helps at any stage. As soon as the patient is stable and the doctor says it can be 3 days, it can be 5 days post-stroke. Earlier you start, better recovery you get. Previously, the thought was that the recovery only happens until 6 months after the stroke, but that's an old thought. The recovery after robotics have come in, the medical fraternity has seen recovery even after 5 years of stroke. So never lose heart. If someone has stroke in the family, continue with therapy, start as soon as possible. First 6 months, brain is more plastic. It takes up information earlier. Later, the recovery will be slower, but recovery will continue to happen at any stage.
Okay. Another question. They were very interested to see a video on Romy, which is that wheelchair that can help elderly climb stairs. Could you actually describe how it helps elderly climb stairs? I think it's both upstairs, going up and going down, right? Could you explain a bit more, please?
Okay. This is world's first walking frame which helps you to go up and down the stairs. Now the key is the gear system on the sides. There was never a walker developed with the gear systems on the side. So depending on, and there's a clutch, as long as once you press the clutch, it releases the gear and it adjusts to the height of the stairs. Same way when you go up the stairs, put the first 2 legs, the front 2 legs on the stair which is higher, and press the clutch, the bottom 2 legs come down to the lower stair and it adjusts to the height of the stairs. So climbing up and climbing down, both it does. Also, it's good for on slopes, because the government has built a lot of slopes around HDB blocks in Singapore, but walking frame is very, very unstable on slopes. You tend to fall backwards because you're going up and the legs of the frame are not at one level. In Romy, you can adjust the legs to the end of the gradient of the slope, and you will have walking frame which is horizontal, not tilting backwards. Yes, you can climb up and down the stairs. It's very safe. It's meant for elderly and it's been tested for FDA. It's got US FDA, tested for 250 kilo of patients. Patient who's as heavy as 250 kilos.
Okay. So if I can just ask Mr. Sadiq, if you could just spell the name again, R-O-A-M-I.
Yeah, like roam I. Roam means I roam around. Roam
So
I.
please search for this keyword, Romy, on YouTube or on the internet if you want to find out more information about this.
Yeah.
As an engineer, I call it variable axis assistance, which is, fantastic.
Yeah, so Romy has I can share a YouTube video. I can share the YouTube.
We have quite a few questions, so I'm going to go through
Yeah,
the other
please
questions.
continue with it.
Yes. So how about non-AI or VR aids? Example, socks fitted with electronic sensors that can help correct gait. What's the status? Is it available commercially?
I didn't get the question. Please repeat the question.
Okay. So the question is, if you have what about non-AI or non-VR aids? Example, socks fitted with electronic sensors.
Right.
They help
Yeah.
correct gait.
Yeah, there are some socks fitted with. I have come across socks fitted with sensors which help in prevention of falls. These socks give you the idea where exactly you're putting pressure on if you're talking about balance. But I haven't seen any research studies published on them yet. It's a very recently developed technology. Somebody is trying to develop it. There are a lot of falls in hospitals. Patients get off the bed and they fall. So many companies have developed a mat. It's a pressure sensor mat. When patient is off the mat, it gives a buzzer. So it buzzers, and the buzzer is at nurse station. She knows the bed number 5 is off the bed. Then if the patient is on high falls risk, the nurses will rush to the room to prevent falls or prevent patient to get off the bed. So someone has developed this socks which has sensors. As soon as patient puts the foot on the floor, the buzzer runs, and then the patient is about to fall. So there are technologies used in different ways. I'm not too sure if this question is directed to balance or something else, but if it's balance, then this is the answer.
I think the question wanted to ask what other types of technologies other than, they say, augmented or mixed reality could help with rehab, and they were looking at all these perhaps even IoT devices or sensors that can help with or telematics, for example.
A lot of technology is being developed. A lot of technology is available. Robotics are coming big ways. You will see exoskeletons available. Very intelligent equipment available which helps you, guide you. So I think the spectrum is so wide, it will be so difficult to explain here, but the technology is coming big way in rehab.
Okay. Is telematics a viable technology for rehab?
Yes, I think it's been tested here as well. One of the hospitals developed, I think it was NUH which developed, and they passed it to a private company. They are running telemedicines or tele rehab, they call it, where you need to have a tablet or a palm top, and you can see therapist in his clinic giving you instruction. You can have an elderly at home and with a helper who follows the instruction or be around the patient so that the patient doesn't fall. And one therapist can guide 10 patients at the same time, because therapist sees all 10 patients on his tablet while the patient sees the therapist on his tablet. So yes, that's possible. And I think this is very important in COVID, because this way we can reach patients home easily without having the contact where it's not needed.
I see. Another question that we have is about combining technology between the old form of rehabilitation and the new technology-based rehabilitation, a kind of between a fusion therapy of new and old. The question comes from someone who's thinking about patients who have preconceived notions about technology and need some persuasion to use it. What is your view, please?
I think I always believe if you have help, please take it, whichever way it comes in. As a therapist also, a lot of physiotherapists, there are different school of thoughts. I can understand where the question is coming from. there are a lot of school of thoughts where physiotherapists wants to use only manual techniques. They say, I will only use hands. But I say, when you have technology to help you to get your patients better, faster, use it. Same is for patients. They have to change this mindset that it's not the patient, the therapist alone or technology alone will help you. You need to combine to get the best results.
Thank you for that, Mr. Saidi. There is a question that's asking a more conceptual question about how technologies allows rehab specialists like yourself and also doctors to be at different places and reach out to people at the same time. So it could be someone in a remote location, for example, or an immobilized patient. We saw that in the video just now. A person could actually go use it from home, or even use and have a picture, a mixed reality picture of a doctor sitting there, or be in a hospital and still actually use VR. Any concerns about technology taking over real interactions between people? What are the pros and cons, and how would the experience be like for more able people?
Yeah, I think, as I said, nothing can replace personal interaction. Because if I am around a patient and I am supervising group of 10 patients, I am seeing them and I can correct them where I need them. So it can never replace the actual sessions. But today we are talking on Zoom. This meeting was supposed to be interactive session face to face. We couldn't do that. But having said that, I think we will still be able to achieve at least 70% of our objectives of the talk, what we were supposed to do in an auditorium. Same is for technology. If we have choice, if we do not have choice, or someone lives very far, there are no family members to bring the patient to the therapy center, use technology. And it may not be 100% effective. It may take a little longer to reach where the goal is, but it will take you there.
Thank you for that. Will one get addicted to VR technology?
Sorry?
Will anybody get addicted to VR technology?
Can anyone get VR technology?
Can get addicted to VR technology. So,
oh yeah, if you are into gaming, yes, it can be addictive. But idea here is to be therapeutic, not addictive. So I suggest, if there is a clinical condition, speak to your therapist. He will advise what sort of therapy you should go through. It's a therapy. We are taking it as a therapeutic tool. It may have games, but objective is to improve functions, not to have addiction.
I think as a side comment as well, I've got 2 young children, and now they're actually doing school learning systems online. And we were worried, would they be able to cope and adjust? And finally, we were worried that they were actually looking at too much content online. But we found it to be a blessing. Instead, it's really augmented their entire learning experience. So I highly advocate it myself. I agree with you, Mr. Saidi. I think it's a wonderful tool. There's another question about how the elderly may or may not be receptive to technology and gadgets, and how they may be resistant. I've also actually noticed this even in my own mother, who is actually resistant to a bit of technology. Can you give us some advice on how we can help our elderly parents or relatives adjust to accept this new technology interventions? What would you suggest to help them?
I think, yeah, breaking this barrier is very important. Once they have experienced it, there is nothing like it, because there is nothing to be not liking about this technology. This is brilliant. It takes you to the world where you have never been. It takes you, when we do therapy with patients, this software can create some kind of unstable environment where patient can't really go, or you will not take them there because you will have a risk of fall. So you can have proper plain ground, but virtually it creates unstable ground. And it gives kind of fun it's a fun therapy. So there is nothing not to like it. I will suggest, let someone try for a very short period of time. You have to give it as a sampler. Once they have it, they have seen it, they will like it. Having said that, everybody is different. You cannot force. You have to, for us also, for our patients, we try and find therapy for their liking. but this is something which has a very high acceptance level.
We have another question that asks, where is Singapore on the global stage in terms of adopting technology such as, you know, what you pointed out in this session for rehab relative to the rest of the world? I think perhaps one way is to understand where we are, and also if there's another location or country that potentially our members can explore going to for rehab treatment.
I work in 3 countries and I see physiotherapists in Singapore, Malaysia, and Thailand. If you talk about technology, I'll say Thailand is number 1. They are very receptive to technology. Singaporeans, they are receptive to technology, but they would like to see an evidence first before they apply. Thailand, they will apply and they will find evidence. So this is the difference in thought process. Malaysia is a follower. They follow what Singaporeans do or Australia does.
So if I can take that question further, would it be sound advice to suggest that since everything's online today, even our conferences, our seminars online today, was it possible for our members to explore getting rehabilitative treatment from a doctor or physiotherapist in Thailand?
Oh yes, that's possible. Even in Singapore, it can be arranged. It's not difficult to do that. Online softwares are available. Also, per use softwares are also available. For memory, for virtual reality rehab program, they are available. I think I will leave you with some links later, which you may want to share with your members. They can explore finding out by themselves. But if they need any help from me, I'll be more than happy to support them specifically for their need.
Okay, perhaps you know, I can ask Jocelyn or someone in NUSS, our committee side, to share this. Maybe your contact is.
Yes, sure.
So
yes.
Maybe an email would that
yes.
be fine? Okay.
That'll be perfect. Yeah, no
Just
problem.
on that note, as well as that contact is going to be shared in the chat that you find in this session. You'll find that also the information about Romy, the chair that some of you have asked about, the variable axis assistance for walker. It's already, the link to the YouTube video has already been shared in the chat. Please refer to the chat at the bottom menu of the Zoom seminar to find out the information there. And you will have the link to the YouTube video. If you do a search online, you'll probably be able to find more product information. Now back to the questions, because I think our audience is making me work very hard and making you work harder. So,
no problem.
This is a very relevant question, and it's about subsidies. So the person who's asked is, they're very concerned with the cost of investing in such equipment, such as the tools that we saw or the lenses, which can potentially be quite expensive. Do you think that the government is providing any subsidies to the Pioneer or Merdeka citizens generation for this? So it's like grants given out for HDB, for grip bars and non-slip floors, etc.
Right. Romy has been put in for subsidy. I understand the approvals got delayed because of COVID-19. We had put in for subsidy. We will have 80% subsidy. Whatever the price is, government. Only thing is, when you go to physiotherapists, you will have to tell them that you would like to have something to climb stairs. And if you have something to share, you can tell them as soon as the government approves it and therapist signs it, you will get 80% subsidy on the price. So you will probably pay around $20 or something, or $30 for Romy.
Okay, wonderful. And now
about virtual reality, I'm not too sure if government will pay for it unless a therapist prescribes. I do not have answer for that.
Okay, so maybe I can also just lend a quick note of opinion on there. So I understand that the government, I was a consultant to the Woodlands Integrated Healthcare Campus that's coming up in Woodlands right now. And my understanding is that the government's very keen to find ways for Singaporean households to receive care from the basis of their home instead of having to go to the hospital for care. So rehabilitation is something that strikes me as something that you can receive from the basis of your home in comfort and at your own time, especially with telemedicine. And with the technology that Mr. Saini showcased to us today, I think that's even more likely in the future. We'll see more of these interventions coming on. And in my humble opinion, I think that it's very likely we will see some support for this. I'm not aware of any support, but it's something to keep your eyes and ears tuned to. Perhaps something that we might hear in some of the elective speeches. Well, I'm not sure, but we'll see. So There's another question that comes in. Is there anywhere that our members can go to experience some of this AR and mixed reality, some kind of showroom per se that they can go to?
I will share with you later. I think I have some places where they have interest to have it or they already have it. Maybe they can drop in an email and I will suggest to them later, depending on what sort of condition it is. Yeah.
Okay. And has any of this VR technology and mixed reality technology been used for Parkinson patients?
Yeah, you see, issue with Parkinson's disease is the balance, and AR is very good to improve balance. So there is no reason. I think there are published research documents that virtual reality improves balance. I do not know if I have any documents on virtual reality improves balance in Parkinson's, but for balance, definitely yes.
Okay. We have a question from a student. I'm very encouraged that we have a student who's attending this seminar, and they have a question for you about their career. They want to pursue physiotherapy as a career. How can they help themselves prepare better for this course and perhaps for a career in rehabilitation, physiotherapy, where there's a lot of technology in the future? How can they prepare themselves better?
Yeah, I think it's a pretty good profession. I can say from my personal experience, not me, I am the physiotherapist. My wife is a physiotherapist. Seeing us as a physiotherapist, my daughter also is a physiotherapist. My niece is a physiotherapist. Her husband is a physiotherapist. So we are a family of 5 physiotherapists. My daughter is in Singapore Institute of Technology. The degree program started 2 years ago. It was earlier in NYP. Now it's in SIT, Singapore Institute of Technology. And I think it's a very good program. They have it with, it's with the Ireland University. It's a twinning program. It's a good degree program and it takes you to places. Physiotherapy is a growing field and is progressing very fast and a lot of technology is coming in as well.
Thank you, Mr. Saidi. Okay, so we've come to around the end of the questions. I've actually collated some of your questions together because they had overlapping themes. I also wanted to mention and quickly summarize the session. Physiotherapy is now moving online. It's actually being boosted by a lot of technologies that are coming to you that you can access from the comfort of your home. And I think that a lot of these technologies, from what Mr. Saidi has shared, are very cost effective and sometimes even free. So we want to encourage our members to really explore this and reach out to their physiotherapists. Physiotherapists will not be replaced, but their practice will be augmented by technology and made much more effective. There are also, if you have attended the session and you would like information to follow up with Mr. Saili in person personally, please refer down to, again, the chat. Mr. Saili's contact email has been actually shared in the chat. Please refer to that, and also information about the Romi chair, which many of you have asked just now, so that you can actually find out more about it online. Again, we have one last question coming in, and I'd like to take that before it goes because it looks like a very important question. If one has osteoporosis or is at the borderline of being osteoporosis, does this exercise or rehabilitation help?
Yeah, you see, for osteoporosis, very specific exercises work. Now, osteoporosis is more common in women after menopause because they tend to, because of lack of hormonal activity, they tend to lose a lot more calcium. So osteoporosis sets in after age of 45, 50 in women, and men have much lesser risk of osteoporosis. The key for osteoporosis is low impact exercises. So high impact exercises are risky and no impact exercises don't really have shown to reduce the delay. Osteoporosis can't be reversed. It can only be delayed or stopped. It cannot be reversed, whatever has happened. Stopping is also, I may be pushing the boundaries a little too much. It can be delayed to a longer period of time. It's an ongoing process. So low impact exercise. You must have seen the vibration therapy. There is a lot of work there was a platform which would move people, hold the bar, and then there's so much of research came on vibration therapy with osteoporosis because it has shown to have the most beneficial effect because it's a low impact exercise. So if you say, shall I choose swimming over brisk pace walking for osteoporosis? I'll say brisk pace walking because swimming does not have any impact. So low jumps, very, very low jumps, whatever causes low impact exercise are known to improve the condition.
Thank you, Mr. Saidi. Now, with that, we've come towards the end of our session. I want to first thank Mr. Saidi for your time. Thank you so much for taking time out. I understand you're still very busy and perhaps even working harder online now. There's more people coming online to meet with you. Thank you for taking time out to really share more with our membership about how physiotherapy can really improve their lives and now how physiotherapy coupled with technology can really help them get better, help them have more fulfilling and more meaningful lives with better exercise, even from the comfort of their home. We look forward to hearing more from you. And our members, please refer to the chat in the Zoom seminar to find out Mr. Saidi's email contact and also for more information about ROAMI, R-O-A-M-I, which is that assistance wheelchair walker, the walker that will actually help you climb upstairs and downstairs. And you can find out more information about it from that link in there. And we would like to encourage you, so this is the first series of seminars online by NUSS, by the Aging Committee. We are very happy to bring these seminars to you. We really strongly encourage you to join the other seminars that are coming that we've organized for our members. Please register and sign up on the NUSS website. We look forward to bringing more interesting content to you. And if you found this session helpful, please give feedback to our organizer, NUSS, Jocelyn and the team, and also state what other topics you're interested in. Thank you very much. Have a blessed time at home. Stay safe, stay healthy. Thank you, Mr. Sandeep.
Thank you very much. Pleasure.
Thank you.
Bye.
3D remote photo.